Bismillahirrahmanirrahim. My topic for today is arthritis. My name is Dr. Ida Shahram Sarwar, and under my supervisor, Dr. Professor Saira Afzal, I will present. My quote for today is: "Darkness cannot drive out of darkness; only light can do that. Hate cannot drive out of hate; only love can do that." And this is by Martin Luther King Jr. The learning outline for today is: what is arthritis? What are the different types of arthritis? Each type of arthritis with its causes, prevalence, treatment, and other facts, differences between rheumatoid and osteoarthritis, general causes of arthritis, risk factors, as well as diagnosis and treatment. Learning outcome. At the end of the presentation, participants will have a broad overview of arthritis, its definition, types, and their subsequent causes, differences, risk factors, as well as how to diagnose and treat each type. What is arthritis? Arthritis basically refers to more than 100 rheumatic diseases and conditions that affect joints. These conditions tend to involve pain, aching, stiffness, and swelling in and around one or more joints. The word arthritis means joint inflammation. However, inflammation may also affect the tendons and ligaments surrounding the joint. The symptoms can develop gradually or suddenly and may impair a person's ability to perform everyday tasks. The most common form of arthritis is osteoarthritis, and other common forms include other rheumatic conditions, including gout and rheumatoid arthritis. Arthritis is a swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis causes cartilage, the hard, slippery tissue that covers the ends of the bones where they form a ligament, where they form a joint to break down. Rheumatoid arthritis is a disease in which the immune system attacks the joints, beginning with the lining of the joints. Uric acid crystals, which form when there's too much uric acid in your blood, can cause gout. Infections or underlying diseases such as psoriasis or lupus can cause other types of arthritis. Treatments vary depending on the types of arthritis, and the main goals of arthritis treatments are to reduce symptoms and improve quality of life. What are the different types of arthritis? Arthritis is a broad term that describes more than 100 different joint conditions. The most common types of arthritis include osteoarthritis, also known as the wear and tear arthritis, which develops when joint cartilage breaks down from repeated stress. It's the most common form of arthritis. Ankylosing spondylitis or arthritis of the spine, which is usually your lower back. Juvenile arthritis, a disorder where the immune system attacks the tissues around the joints and typically affects children 16 years or younger. Gout, a disease that causes hard crystals of uric acid to form in your joints. Psoriatic arthritis, which causes joint inflammation that develops in people with psoriasis. An autoimmune disorder that causes skin inflammation, irritation. Rheumatoid arthritis is a disease that causes the immune system to attack the synovial membrane in your joints. What is osteoarthritis? Osteoarthritis is also known as degenerative joint disease. It is the most common type of arthritis and is most likely to develop as people age. The changes in osteoarthritis usually occur slowly over many years, though there are occasional exceptions. Inflammation and injury to the joints causes bony changes, deterioration of tendons and ligaments, and a breakdown of cartilage, resulting in pain, swelling, and deformity of the joint. Here you can basically see a normal knee and an arthritic knee, and you can see the wear and tear aspect. There are two main types of osteoarthritis. There's primary and secondary. Primary is more common, but generalized primarily affects the fingers, thumbs, spine, hips, knees, and the big toes. And secondary occurs with pre-existing joint abnormalities, including injury or trauma, such as repetitive stress, or sports-related inflammatory arthritis, such as rheumatoid, psoriatic, or gout, infectious arthritis, genetic joint disorders, such as Ehlers-Danlos syndrome. Who is affected by osteoarthritis? Approximately 80% of older adults ages 55 years and older have evidence of osteoarthritis on X-ray. Being obese also increases your risk of these. An estimated 60% experience the symptoms. It is estimated that 240 million adults worldwide have symptomatic osteoarthritis, including more than 30 million US adults. Postmenopausal women have an increased incidence of knee osteoarthritis as compared to men. Symptoms include these are typically going to develop slowly and worsen over time, and these include pain, stiffness, joint stiffness, which is most noticeable upon waking up or after being inactive, tenderness, loss of flexibility, grating sensation, bone spurs, as well as swelling. In this photo, you can see the thickened, stretched capsule, rough and thinning cartilage, bone spurs, which are osteophytes, and thickened inflamed synovium. Ankylosing spondylitis. Ankylosing spondylitis is a form of arthritis that causes long-term spine inflammation. It inflames the sacroiliac joints located between the base of the spine and the pelvis. This inflammation, called sacroiliitis, is one of the first signs of AS. Inflammation often spreads to joints between the vertebrae, and this is known as spondylitis. Some people with AS experience severe, persistent back and hip pain and stiffness. Others have milder symptoms that can come and go. Over time, new bone formations may fuse the vertebral sections together, making the spine rigid, and this is known as ankylosis. What basically causes ankylosing spondylitis? About 95% of people who have AS have a variation of the human leukocyte antigen B gene HLA-B. This changed or mutated gene produces a protein called HLA-B27 that increases the disease risk. However, most people with the mutated HLA-B gene don't get AS. In fact, 80% of children who inherit the mutated gene from a parent with AS don't develop the disease. More than 60 genes have been linked to this condition, and having one of these conditions may increase your risk. That includes Crohn's disease, ulcerative colitis, as well as psoriasis. Juvenile idiopathic arthritis is the most common type of arthritis that affects children. It is a long-lasting disease that can affect joints in any part of the body. It is an autoimmune condition in which the body's immune system mistakenly targets the synovium, the tissue that lies inside the joint, and the synovial fluid in the joint. This causes the synovial to make extra synovial fluid, which leads to swelling, pain, and stiffness in the joint. This process can spread to the nearby tissues, eventually damaging cartilage and bone. Other areas of the body, especially the eyes, may also be affected by inflammation. If not treated, it can interfere with a child's normal growth and development. The etiology is basically idiopathic. The peak age of onset is between 2 to 4 years. Serology is typically negative for autoantibodies. Lab studies suggest anemia, leukocytosis, thrombocytosis, and complications include macrophage activation syndrome. The symptoms that present include intermittent fever, generalized lymphadenopathy, psoriatis, hepatomegaly and/or splenomegaly, a transient salmon pink rash, and arthritis synovitis of the knees, ankles, and small joints of the hands. What is gout? Gout is basically a painful form of arthritis when your body has extra uric acid. Sharp crystals may form in the big toe or other joints, causing episodes of swelling and pain called gout attacks. Gout is treatable with medications and changes in diet and lifestyle. Doctors place gout under the umbrella term arthritis, a broad range of joint diseases and joint pain. Some forms of arthritis inflame joints, while others don't. Gout is a common form of inflammatory arthritis, and it is due to a crystal called uric acid. Gout causes pain and swelling in one or more of the joints. It typically affects the big toe, but it is also found in other joints, including the knee, ankle, foot, hands, wrist, and elbows. Who is affected by gout? Gout can affect anyone. It usually occurs earlier in men than women. It generally occurs after menopause in women. Men can be 3 times more likely than women to get it because they have higher levels of uric acid most of their lives. Women tend to reach their levels after menopause. People are more likely to get gout if they're overweight, have congestive heart failure, diabetes, family history of gout, hypertension, as well as kidney disease. You're more likely to develop gout if you consume a diet that is high in animal proteins, significant amounts of alcohol, and are on diuretics. And here you can see that it prevents with the joints that are affected include the finger joints, the knee joints, the big toe, as well as the ankle joint. How is gout treated? Your healthcare provider may prescribe certain medications to treat gout. Pharmacological therapy is initiated within 24 hours once the attack has taken place, and some drugs that basically help to control the symptoms include NSAIDs. Colchicine can reduce, which are non-steroidal Drugs and colchicine can reduce inflammation and pain if you take it within 24 hours of a gout attack. It's given by mouth. Corticosteroids and drugs that help lower the levels of uric acid in your body or prevent future episodes of gout include allopurinol, which is taken as a pill. This is the first line treatment for Bexotat, taken as a pill, Pelaglostat, which is given as IV, and propionic acid, which is also taken as a pill. Psoriatic arthritis. Up to 30% of people with psoriasis can develop psoriatic arthritis. Although there is no cure for this condition, understanding the disorder and knowing what to expect can help reduce discomfort, stress, and fatigue. It is basically a form of inflammatory arthritis categorized by joint pain, swelling, and morning stiffness. It is associated with having psoriasis or a family history of psoriasis. Both psoriasis and psoriatic arthritis are chronic autoimmune diseases, meaning conditions in which certain cells of the body attack other cells and other tissues of the body. These can vary from mild to severe. It can present in the following ways, which is oligoarticular, affecting four or fewer joints in the body, polyarticular, affecting four or more joints, and spondylitis, less common, affecting the spine, hips, and shoulders. What basically causes psoriatic arthritis? The cause of psoriatic arthritis is unknown. Researchers suspect that it develops from a combination of genetic, hereditary, and environmental factors. Recent research has shown that people with psoriatic arthritis have an increased level of tumor necrosis factor in their joints and affected skin areas. Rheumatoid arthritis is a type of arthritis where your immune system attacks the tissues lining the joints on both sides of your body. It may affect other parts of your body too. The exact cause is unknown. Treatment options include lifestyle changes, physical therapy, occupational therapy, nutritional therapy, medication, as well as surgery. It is an autoimmune disease that is chronic. It occurs in the joints on both sides of your body, which makes it different from the other types of arthritis. You may have symptoms of pain and inflammation in your fingers, hands, wrists, knees, ankles, feet, and toes. And the effects on the body include fatigue, eye conditions, dry mouth, lung scarring or nodules, digestive problems, heart disease, skin conditions, cartilage damage, as well as inflammation. Uncontrolled inflammation damages cartilage, which normally acts as a shock absorber in your joints. In time, this can deform your joints. Eventually, your bone itself erodes. This can lead to fusion of your joints, an effort of your body to protect itself from constant irritation. Specific cells in your immune system aid this process, and the substances are produced in your joints but also circulate and cause symptoms throughout your body. In addition to affecting your joints, rheumatoid arthritis sometimes affects other parts of your body, including skin, eyes, mouth, lungs, and heart. Here you can see a normal joint, an osteoarthritic joint, and a rheumatoid arthritis joint. You can basically see that in osteoarthritis, the bone ends have rubbed together and there's thin cartilage, and in a rheumatoid arthritic joint, there's swollen, inflamed synovial membrane along with bone erosion. The diagnosis of this disease is through physical exam, family medical history, rheumatoid factor and anti-CCP blood test, ESR test, as well as X-ray. Treatment options include NSAIDs, which are non-steroidal anti-inflammatory drugs such as ibuprofen, and DMARDs, which are short for disease-modifying anti-rheumatic drugs. Usually the first line of treatment, an example is methotrexate. Biologics, which is the newest kind on the block, offer powerful and highly targeted treatment to slow down its progression. And steroids, which are used for calming down flares and can be injected into joints for quick relief, best for short-term use only. The differences between osteoarthritis and rheumatoid arthritis include that osteoarthritis is a degenerative joint disorder. Rheumatoid arthritis is an autoimmune disorder. The onset is that it develops gradually over years as the joint cartilage wears away, and the onset in rheumatoid arthritis, on the other hand, develops and worsens over several weeks or months. The osteoarthritis is more prevalent and affects more than 30 million adults in the United States, and rheumatoid arthritis affects 1.3 million Americans, of which 75% are women. Location of osteoarthritis is common in the hip, knees, lower back, neck, feet, and finger joints, and the location in rheumatoid includes in any joint, common in hands, wrists, and feet. Joint stiffness is mild in the morning and occurs after a few hours of inactivity during the day, and in rheumatoid, it's prolonged hours of stiffness and takes longer periods of time to subside. Symptoms include joint pain, stiffness, muscle weakness, and reduced motion, creaking. And symptoms in that case include pain, stiffness, inflammation, bumps or nodules, fatigue, fever, and loss of appetite. Treatment include pain medicine, heat or ice, weight loss, exercise, surgery, and in that case includes rest, splints, balanced diet, exercise, as well as healthy weight. Causes of arthritis include wear and tear of a joint from overuse, age, injuries, obesity, autoimmune disorder, genes or family history, as well as muscle weakness. How is arthritis diagnosed? Seeing your primary healthcare physician is a good first step to see if you're unsure for arthritis diagnosis. They perform a physical exam to check for fluid around the joints, warm or red joints, and document the range of motions. And then you're recommended to a specialist. If you're experiencing severe symptoms, you can schedule an appointment with the rheumatologist, and this can lead to faster diagnosis. Documenting inflammation levels in your blood and aspirating and analyzing joint fluids if present can help your doctor determine what kind of arthritis you have. Blood tests that check for the specific types include the rheumatoid factor, the anticyclic citrulated peptide, and the anti-nuclear antibody are also common. Doctors commonly use imaging scans such as X-ray, MRI, and CT scans to produce an image of your bones and cartilage. This helps them rule out other symptoms such as bone spurs. How is arthritis treated? The main goal of treatment is to reduce the amount of pain you're experiencing and prevent additional damage to the joints. In general, the treatment for the conditions include physical therapy, occupational therapy, a nutrient-rich diet, regular exercise, weight loss, heat and cold compresses, mobility assistant devices such as canes or walkers, and improving joint function is also important. Supplements include, while clinical evidence and safety are lacking for many herbs and supplements marketed for arthritis, there are few supplements that may be beneficial that include avocado, soybean, unsaponifiable that can help osteoarthritis symptoms, fish oil, and turmeric supplements which can help reduce inflammation. Surgery to replace the joint with artificial one may be an option. This form of surgery is most commonly performed to replace the hips and knees. If your arthritis is most severe in your fingers or wrist, your doctors may perform joint effusion. In this procedure, the ends of your bones are fused, eliminating the joint and therefore eliminating the site of inflammation. Also includes physical therapy, which involves exercise that helps strengthen the muscles and affected joint, which is a core component of arthritis treatment. Then we come to recent advances. Early referral recommendation for newly diagnosed rheumatoid arthritis, evidence-based development of a clinical guide. Background: effective treatment of rheumatoid arthritis requires early diagnosis and early disease modifying anti-rheumatic drug treatment to have impact on long-term morbidity and mortality. Clinical criteria would facilitate early referral of the patient with suspected RA to a rheumatologist for definite diagnosis and initiation of DMARD treatment at that point in the disease, most likely to have an impact on long-term outcome. Objective: to develop a referral recommendation that may serve as a clinical guide for primary care doctors, enabling them to identify patients with suspected RA during the early inflammatory stages. Results: clinical evidence strongly supports this observations that structural damage occurs early in active RA and that early DMARD treatment improves the long-term outcomes of the disease. The observations indicate that the rapid referral to a rheumatologist is advised when RA is suspected. This may be supported by the presence of any of the following: greater than 3 or 3 swollen joints, metatarsophalangeal or metacarpophalangeal involvement, and morning stiffness of greater than or equal to 30 minutes. Long-term impact of delay in assessment of patients with early arthritis. The objective for this includes, during the last decade, rheumatologists have learned to initiate DMARDs early to improve the outcome of RA. However, the effect of delay in assessment by rheumatologists on the outcome of RA has scarcely been explored. The purpose of this study was to examine the association between a delay in assessment by rheumatologists, rates of joint destruction, and probability of achieving DMARD-free remission in patients with RA. Patient characteristics associated with the delay by the patient, by the GP, and overall were assessed. Conclusion of the study was that only 31% of patients were assessed in less than 12 weeks of symptom onset. Assessment in less than 12 weeks is associated with less joint destruction and a higher chance of achieving DMARD-free remission as compared with the longer delay in assessment. These results imply the attempts to diminish the delay in seeing a rheumatologist, which will improve the disease outcome in patients with RA. Now coming to MCQs. A man 65 years of age developed pain and stiffness in his knees, which progressively got worse over a span of 7 years. Following an injury, he has lost some flexibility of his knee joint and experiences a grating sensation upon movement. Which condition is he suffering from? A. Osteoarthritis, B. Rheumatoid arthritis, C. Gout, D. Psoriatic arthritis, or E. Ankylosing spondylitis. Anyone? The answer is A. Osteoarthritis. A postmenopausal woman with incidence of knee pain was diagnosed with osteoarthritis on X-ray. Which part of a joint does this type of arthritis usually affect? A. Bone, B. Cartilage, C. Tendon, D. Bursa, or E. Ligaments.
Cartilage.
Yes, the answer is 2B. Osteoarthritis, also known as degenerative joint disease, is the most common type of arthritis. Inflammation and injury in the joint causes bony changes, deterioration of tendons and ligaments, and a breakdown of cartilage, resulting in pain, swelling, and deformity of the joint. Which of these makes you more likely to get this disease? A young age, B, excess body weight, C, too little body weight, D, back pain, or E, being African American.
B.
Yes,
B.
the answer is B. 4. A 40-year-old obese man with poor drinking habits developed pain and swelling in the big toe. Upon visiting the doctor, he was diagnosed with gout. What is the recommended first-line therapy for gout? A. Probinic acid, B. Allopurinol, C. Febuxostat, D. Benzobromarone, or E. Panadol.
B.
Yes, the answer is allopurinol. Based on the previous scenario, pharmacological therapy can be initiated after how long once the acute gout attack has taken place? A, after 48 hours, B, within 1 hour, C, within 24 hours, D, after 20